All right, so today we're going to really dig into some fascinating stuff about myocardial infarction.
Or, as most people know it, a heart attack.
Right, a heart attack. We've got a really in-depth guide and a Q&A, both from some major sources like the American Heart Association. So by the end of this deep dive,
You'll have a really solid understanding of what MI is.
how to recognize it, how to prevent it, and what to do if, God forbid, you have one.
Yeah, because one thing people often misunderstand is that it's not always like what you see in the movies.
That sudden, dramatic clutching the chest.
Right. It's often like a buildup of different factors over time.
So let's break that down a little bit. First, just for folks who maybe aren't super familiar with all the medical terminology, can you explain what actually happens during a heart attack?
Sure. So essentially, it's a blockage of blood flow to a part of the heart muscle. And usually that's caused by this buildup of plaque in the coronary arteries.
So you imagine a pipe.
Exactly, like a clogged pipe. And so that means the heart isn't getting the oxygen it needs to function properly.
And that can lead to
Yeah, damage to the heart tissue. Or even, in the worst case scenario.
death of that tissue.
Right, exactly.
So how important is it to catch it early? Like, how much does early detection and treatment really matter?
Oh, it's absolutely critical. The sooner someone gets medical attention, the better their chances are of, keeping that damage to a minimum.
Minimizing the damage.
Yeah, and having a much better recovery. And that's why, knowing the risk factors is just so essential.
Yeah, let's talk about those risk factors. I mean,
Yeah.
I feel like we all hear about the usual suspects, right? Like high cholesterol, high blood pressure, smoking, diabetes, obesity.
Right, all those things we know we should be watching out for.
We hear it all the time.
Yeah, those are definitely big contributors for sure. But age and family history also play a really big role, even though we can't control those, right?
Right, right.
And here's one that I think is often overlooked, and that's stress.
Stress?
Yeah.
I mean, I know it's not good, but how much does stress actually, impact your heart?
Well, we're going to dive deeper into this a little later, but chronic stress can actually cause all these physiological changes in your body, like increased blood pressure, your heart's beating faster, and all that just puts way more strain on your heart, especially after someone's already had an MI.
I'm definitely interested to hear more about that later on. But for now, let's talk about those warning signs. So if someone thinks they might be having a heart attack, what should they be looking out for?
So, the classic symptoms that most people think of are things like chest pain. It might feel like tightness or pressure, and it can radiate out to the arms, the neck, the jaw, even the back.
Sure.
Shortness of breath, sweating, nausea, feeling lightheaded, those are all common signs too.
So like the typical...
Right, the Hollywood heart attack.
Yeah, movie,
the chest.
clutching the chest.
Yeah. But you mentioned earlier that it's not always so clear-cut.
Right.
In women, older people, and people with diabetes, the symptoms can be much more subtle.
So it might not be that classic, intense, crushing chest pain.
Right.
So even more reason to be aware of those maybe less obvious signs if you have any of those risk factors.
Oh, absolutely. And if there's ever any doubt, it's always better to be safe than sorry. Just go get checked out.
Good advice. So let's say someone thinks they are having a heart attack. What happens next?
Well, getting a quick diagnosis is really key. So doctors will use things like electrocardiograms, which are called EKGs. Those measure the heart's electrical activity. And then they'll also do blood tests, and those can look for specific proteins that get released when the heart muscle is damaged. And then there's also imaging techniques like echocardiograms or angiography, and those can actually, give a really detailed picture of what's going on with the heart and the blood vessels.
So it's really a race against time.
It is, yeah.
The faster they can diagnose it, the faster they can start treatment. So what are some of the options for treating a heart attack?
Well, it kind of depends on how severe the blockage is. There are medications like thrombolytics. Those are designed to break up blood clots. Antiplatelets like aspirin can help prevent further clotting. And then beta blockers, those reduce the workload on the heart.
And what about things like angioplasty or bypass surgery? I know people who have had those after heart attacks.
Right, yeah. So angioplasty, the technical term is percutaneous coronary intervention, or PCI.
Okay.
And that's basically a minimally invasive procedure where they insert a thin tube with a balloon on the end into the blocked artery, and then they inflate the balloon to open up the artery. And often they'll put in a stent to kind of keep it open.
Like a little scaffold.
Yeah, exactly. And then in more severe cases, they might need to do coronary artery bypass grafting, or CABG.
Okay.
And that's where they actually take a healthy blood vessel from another part of your body and use it to bypass the blocked artery.
So someone has the heart attack, they're treated. What comes next?
Well, that's where what we call post-MI care comes in. And that's not a one-time thing. It's really an ongoing process. Uh-huh.
It's about making long-term changes so that, you can prevent another cardiac event. And there are three main pillars to that.
Yeah.
Making sure you're taking your medications as prescribed.
Sticking to that.
Keeping up with those follow-up appointments with your doctor.
Okay.
And then making some big lifestyle changes, which is really key.
So let's talk about those lifestyle changes, because I think that's probably where a lot of people are going to have questions. Like, what does that actually look like? What are we talking about here?
Well, the big ones are diet and exercise, right?
Mm-hmm.
Doctors usually recommend a heart-healthy diet, like the Mediterranean diet, which focuses on things like fruits, vegetables, whole grains, healthy fats.
Right, the good stuff.
Exactly, yeah.
Yeah.
What I thought was really interesting was our source material actually had a list of specific foods to really focus on and then others to completely avoid.
Yeah.
Which I thought was, super useful for people who are trying to make those changes. Absolutely actionable advice. I love that. And what about exercise? I mean, I assume it's important, but are there certain types that are better than others, especially after a heart attack?
Exercise is definitely crucial, but of course, safety comes first. Your doctor will help you figure out what's appropriate for you.
Right.
But, in general, moderate intensity aerobic exercise is a good place to start. Things like brisk walking, swimming, cycling, those are all great for strengthening your heart and improving your circulation.
Makes sense. It's funny because we were talking about stress earlier, and I remember reading in our sources that they talked about that too, like how stress impacts recovery.
Oh, yeah, they did. And that's a big one that people don't always think about enough. It's not just how stress makes you feel, but the physical effect it has on your heart, especially after you've had an MI.
So it's not just about trying to avoid stressful situations. It's about actually learning to manage your stress levels.
Exactly.
And that brings us to the next part of our deep dive today, which is our mindfulness toolkit.
Ah, yes. So this is where we get into some practical things that people can do every single day to manage stress and promote healing. Our sources talked about deep breathing exercises, progressive muscle relaxation, guided meditation, even mindful walking.
Mindful walking. What is that? Like just paying attention to what's around you while you're walking.
Yeah, pretty much. And it's not just some new agey thing. There's actual physiological benefits to it. It can help lower your blood pressure, slow down your heart rate, and just help you feel more calm and in control.
It almost sounds too simple.
I know, right?
But I'm willing to try it.
Yeah.
Okay, so before we all get too relaxed, let's move on to our next topic.
Yeah.
The importance of support.
Right. Having family and friends, that social support, is so important for recovering emotionally after a heart attack. Having people around you who care can make a huge difference.
So what can loved ones actually do to help? Did our sources have any specific tips on that?
They did. It sounds obvious, but being understanding and patient is huge. And just encouraging healthy habits. They can also help just by being a good listener, helping with practical stuff like cooking or driving.
Yeah.
Or just being there for company and comfort.
Just showing up.
Yeah.
Right. It's good to remember that nobody has to go through this alone.
Absolutely.
Okay. Which brings us to our final topic for this part of our deep dive.
Mm-hmm.
The role of technology.
Now, this is where it gets interesting.
Right. We're talking about apps and gadgets and all the things that can help us manage our heart health.
Exactly. Technology has come a long way in helping people, especially after an MI. You've got apps that can track your heart rate, remind you to take your meds, even detect irregular rhythms. Wearables can track your activity levels, your sleep. It's all really valuable information.
It's amazing how much technology can do now. It can really be a powerful tool in all this.
It can. And the potential is just going to keep growing, which actually leads to a pretty interesting question.
Ooh, I love a good cliffhanger. What question is that?
We'll save that for the next part of our deep dive, but I'll give you a hint. It has to do with the future of managing stress and how tech might play a role in that.
Ooh, all right. Intrigued. Listeners, make sure you join us for part 2 of our exploration into myocardial infarction, where we'll unpack even more fascinating insights and practical tips. See you then.
So, welcome back to our deep dive on myocardial infarction. Before the break, we were talking about technology and how it's playing a bigger and bigger role in managing heart health, right?
Right.
And it got me thinking, we have all these amazing tools now for monitoring our physical heart health, but what about our emotional well-being? Shouldn't that be a part of the equation too?
Yeah, that's a really good point. I mean, we've talked about how bad stress is for your heart, especially after an MI, and how mindfulness can help. But what if there was tech that could actually monitor and manage stress in real time?
Imagine, like, a wearable that could pick up on those subtle physiological changes that happen when you're stressed, like heart rate variability, even slight changes in your skin temperature.
Oh, wow. So like a personal early warning system for stress.
Exactly. It could alert you before you even consciously realize you're feeling stressed, and then maybe even guide you through some personalized relaxation techniques.
So it'd be like having a mindfulness coach right there on your wrist, reminding you to take a deep breath before things get out of hand. That would be amazing.
I know, right? And it's not as sci-fi as it sounds. Researchers are already working on this kind of stuff. Think about biofeedback apps that could teach you how to, like, physically calm your body down, or VR experiences that could transport you to these super relaxing environments.
Wow, that's incredible. It makes you wonder what other kind of breakthroughs are just around the corner.
It really does. Speaking of breakthroughs, let's switch gears a bit and talk about something that I found really interesting in our source material. It was this list of specific foods that people should avoid after a heart attack.
Oh yeah, that list was eye-opening. We all know that a healthy diet is important, but I was really impressed with the level of detail they went into.
Right. It goes way beyond just cutting back on fat and sugar. They actually name specific culprits that heart attack survivors should just completely eliminate from their diet.
Yeah, let's break that down for our listeners.
Yeah.
So obviously processed foods are at the top of the list. Fast food, packaged snacks, basically anything that comes in a box.
Right. All that stuff is loaded with unhealthy fats, sodium, artificial ingredients. It's just not good for your heart. Then there are red meats and processed meats like bacon, sausage, deli meats. Those are high in saturated fat and cholesterol.
And of course, sugary drinks. Soda, sweetened juices, energy drinks. They're basically just liquid sugar bombs. And they contribute to weight gain, inflammation, all sorts of problems.
Yeah, for sure. And while we're on the subject of sugar, let's not forget about all those commercially baked goods. You know, pastries, cookies, cakes, they're full of sugar, unhealthy fats, refined flour.
It seems like a good rule of thumb is if it's in a brightly colored package with a cartoon character on it, it's probably not heart healthy.
Pretty much. But here's the good news. Our sources also provided a great list of heart-healthy foods that people should be eating. And it's not all salads and sprouts, I promise.
Okay, good, because that's not exactly my idea of a delicious meal. So what are some of the things we should be filling our plates with?
Foods that are rich in omega-3 fatty acids are a great place to start. Things like salmon, flax seeds, walnuts. They help reduce inflammation, lower triglyceride levels, and they're really good for your blood vessels.
So omega-3s are kind of a heart-healthy superhero.
Yeah, pretty much. Then there's fiber-rich foods like leafy greens, berries, whole grains. Fiber helps lower cholesterol, and it keeps your digestion running smoothly.
And I know potassium is really important for regulating blood pressure, right? So things like bananas, leafy greens again, sweet potatoes, those are all good sources of potassium.
You got it. And we can't forget about antioxidants. Those help fight off those harmful free radicals that can damage your heart tissue. So load up on colorful fruits and veggies like berries, citrus fruits, and more of those leafy greens.
Man, you're making me hungry just talking about all this delicious food. It's good to know that eating heart healthy doesn't have to be boring.
Absolutely. It's all about finding meals that you enjoy and that are good for you.
Speaking of being good for you, you mentioned portion control earlier. Is that important too, even if you're eating healthy foods?
Oh, yeah, for sure. Even the healthiest foods can lead to weight gain if you eat too much of them.
Mm-hmm.
So pay attention to portion sizes and listen to your body's cues. Eat when you're hungry, stop when you're comfortably full.
That's a good reminder. It's not just about what you eat, but how much. And speaking of healthy habits, regular exercise is crucial too, right?
Absolutely. We touched on this earlier, but it's worth emphasizing again. Physical activity is so important for maintaining heart health, especially after an MI.
So what are the best types of exercise for someone who's recovering from a heart attack? Do they need to be like hitting the gym every day?
You don't have to go that hard. Moderate intensity activities like brisk walking, swimming, cycling, those are all excellent for your heart.
And what about strength training? Is that safe to do after a heart attack?
It can be, but it's important to start slow and gradually increase the intensity. Talk to your doctor about what's right for you.
So it's all about finding activities you enjoy and that you can stick with long term. Something you can make a part of your routine without it feeling like a chore.
Exactly. Exercise shouldn't feel like a punishment. If you find something you like, you're much more likely to keep doing it.
And don't forget about the social aspect. Joining a gym, a group fitness class, or even just walking with a friend can make it more fun and help you stay motivated.
Absolutely. Having that social support can make a big difference in sticking with healthy habits, which actually brings us to our next topic.
Okay, I'm listening. What's next?
Let's talk about sleep.
Sleep. I mean, I know it's important for overall health, but is it really that crucial for your heart?
It really is. When you don't get enough sleep, your body produces more of the stress hormone cortisol.
Cortisol. That's the one that always seems to be causing trouble.
Right. And cortisol raises your blood pressure and heart rate, which puts more strain on your heart.
So basically, not getting enough sleep is like a double whammy of stress for your heart.
You could say that. That's why it's so important for people who've had a heart attack to make sleep a priority. Aim for 7 to 9 hours of good quality sleep each night.
I know, easier said than done sometimes. But are there any tips for getting better sleep?
Well, our sources really emphasize having a consistent sleep schedule. Try to go to bed and wake up around the same time every day, even on the weekends. That helps regulate your body's natural sleep-wake cycle.
I know. Giving up that weekend sleep in is tough.
It is.
But a healthy heart is a pretty good motivator. What else can we do?
Don't underestimate the power of a relaxing bedtime routine. Take a warm bath, read a book, listen to calming music, and try to avoid screens for at least an hour before bed.
Right, that blue light from screens can really mess with your sleep.
It can, and if you're still struggling, talk to your doctor. There might be some underlying issues that need to be addressed.
Okay, so we've covered diet, exercise, and sleep. What else can people do to improve their long-term health after a heart attack? Any other lifestyle factors we should be thinking about?
Well, one of the most important things is to stay connected with your healthcare team.
So regular checkups are key.
Exactly. Those follow-up appointments are essential for monitoring your progress, making any necessary adjustments to your medication, and addressing any concerns you might have.
It's like having a pit crew for your heart, making sure everything's running smoothly.
I love that analogy. Your healthcare team is there to support you every step of the way.
Now, speaking of support, our sources also talked about how important those family and social connections are throughout the recovery process.
It's true. Having a strong support system can make all the difference in the world, both emotionally and practically. Loved ones can listen, offer a shoulder to cry on, and help with everyday stuff like cooking, cleaning, or giving you a ride somewhere.
It's that reminder that you don't have to go through this alone. There are people who care and want to help.
Exactly. And don't be afraid to reach out for help when you need it, whether it's from family, friends, a support group. Connecting with others who get it can be incredibly healing.
That's a great point. So we've covered a lot of ground in this segment. We talked about the potential of technology to monitor stress, the importance of sleep, the power of social support.
And we're not done yet. In our final segment, we're going to dig a little deeper into the psychological effects of having a heart attack and explore some strategies for coping with the emotional side of recovery.
This has been so insightful so far. Listeners, be sure to stick with us for the final part of our deep dive into myocardial infarction, where we'll wrap things up with a look at the emotional side of heart health.
Welcome back, everyone. As we wrap up our deep dive on myocardial infarction, I want to talk about something that I think is super important, but that doesn't always get a lot of attention.
Yeah.
And that's the psychological impact of having a heart attack.
It's true. I mean, we focus so much on the physical side of things, but a heart attack can really mess with you emotionally, too.
Right, because it's not just about recovering physically, it's about processing this major life event. I mean, you're suddenly faced with your own mortality.
Exactly. You're having to make all these big changes to your lifestyle. It's a lot to handle.
It really is. So what are some of the emotions that people typically experience after a heart attack?
Well, anxiety is a really big one.
Okay.
A lot of people develop this fear of having another one, which is completely understandable, right?
Of course. They start to worry about their health, their future, even just doing everyday things that they used to do without thinking twice.
So it's not just about getting back to normal physically. It's about feeling safe and secure again, too.
Absolutely. And along with anxiety, depression is also pretty common. You know, feeling sad, hopeless, losing interest in things they used to enjoy.
Right.
They might feel tired all the time, have trouble concentrating.
So the emotional toll can be just as heavy as the physical one.
It can be, yeah. And sometimes people even experience symptoms of PTSD.
PTSD?
Really?
From a heart attack?
It might sound surprising, but you have to remember that heart attack can be a really traumatic experience. It's scary, it's overwhelming.
Oh, yeah, for sure.
And some people have flashbacks, nightmares, even panic attacks that are related to what happened.
Wow, I never thought about it like that. So what can people do to cope with these emotional challenges? Are there resources that can help them deal with all this?
Well, the first thing is to just acknowledge those feelings. Don't try to bottle them up. It's okay to not be okay. Talking to someone you trust, a friend, family member, a therapist, that can make a huge difference. Just expressing how you're feeling can really help.
It's like letting some of that pressure out.
Yeah, exactly. And there are specific therapies that can be helpful too. Cognitive behavioral therapy, or CBT, is often recommended for anxiety and depression.
Okay.
It helps people learn how to change negative thought patterns and develop healthier ways of coping.
So it's like retraining your brain to approach things in a more positive way.
Yeah, that's a good way to put it. And then there are support groups, which can be so valuable.
Right.
Being able to connect with other people who've been through the same thing, share your story, and hear their experiences, it can be really validating and empowering.
Yeah. It's that sense of community and knowing that you're not alone.
Exactly. And along with therapy and support groups, there are also those lifestyle changes that can help with both your physical and emotional recovery. We've talked about diet, exercise, sleep, but there are things that are especially good for managing stress and improving your mood. Remember our mindfulness toolkit.
Oh, yes. Our mindfulness toolkit, those simple but powerful techniques.
Right. Things like meditation, deep breathing exercises, yoga, those can help calm your nervous system, reduce anxiety, and just make you feel better overall.
It's like giving your mind a break from all the stress and worry.
I like that. And the great thing is, these techniques are available to everyone. You don't need any special equipment or training. You can find guided meditations online, download apps, or just take a few minutes to focus on your breath.
And don't forget about nature. Our sources mention mindful walking is a great way to get some exercise and de-stress at the same time. Just being outside, connecting with nature, it can be really restorative.
It really can. Spending time in nature has so many benefits, both physically and mentally. You know, soaking up some sun, getting some fresh air, listening to the birds, it can really lift your mood.
Yeah, definitely. So I think the main takeaway here is that it's so important to find healthy ways to cope that work for you and make them a part of your daily life.
That's a great way to sum it up. And remember that recovery is a process. It takes time, and it's okay to ask for help when you need it.
That's a really important reminder. Well, that brings us to the end of our deep dive into myocardial infarction.
Yeah.
We've covered a lot today. Everything from the basics of what a heart attack is to lifestyle changes, stress management techniques, and the emotional aspects of recovery.
I hope our listeners are feeling more informed and empowered to take care of their heart health.
I do too. And remember, if you have any concerns about your heart health, talk to your doctor. Early detection and treatment are so important. And don't forget to be kind to yourself. Recovery takes time.
It does. Thanks for joining us on this deep dive into myocardial infarction. Until next time, stay curious, stay informed, and take good care of yourselves.